Hi, welcome to CR Arthritis at the Canadian Rheumatology Association and Arthritis Health Professions Annual Scientific Meeting. My name is Eileen Davidson. I'm a member of the Arthritis Research Canada Patient Advisory Board, a writer for Creaky Joints, and Chronic Eileen. It is my pleasure to be here today interviewing Dr. Jasmin Ma. She is an Arthritis Research Canada Post-Doctoral Fellow. Jasmin has a passion for helping people of all abilities get active. Her research and experience as a registered kinesiologist and certified inclusive fitness trainer focus on physical activity, behavioral science, and integrated knowledge and translation. Working with people with rheumatoid arthritis, spinal cord injury, and other chronic conditions, disabilities to stay active. So now, Jasmin, can you tell us a little bit about yourself and how you got involved in rheumatology?
Yeah, for sure. Yeah, and thanks for the introduction, Annie. You know, I love spending my time with you and chatting with you. Yeah, so in terms of my role in rheumatology, I'm a kinesiologist and a postdoctoral fellow. So a lot of my research focuses around how we can support people with rheumatoid arthritis, particularly, to participate in more strength training. Strength training it's a tough behavior. We know that only about 1 to 31% of people with rheumatoid arthritis are participating in strength training, and largely because there are so many barriers that get in the way. So that's yeah, kind of my line of research, and you know very well that line of research as a partner on our research team. That's our MO.
Now, what exactly is a kinesiologist and how can they help patients living with arthritis? Particularly, what is the difference between a kinesiologist and a physiotherapist?
Yeah, that's a great question. I think we get that question all the time. So the way I sort of see, so kinesiology is the application and study of human movement. And we know that physiotherapists obviously work in the realm of human movement as well, but they have a particular focus on rehabilitation. Whereas I would say the role of the kins are more on the focus of health enhancing levels of physical activity, really focus on improving quality of life. So perhaps, you know, I think that physios and kinesiologists can work very well together. Just looking at those different you know, time points in the continuum of care, right? You know, perhaps you might see a physiotherapist for a particular injury or movement limitation, and kinesiologists will help you focus on how you continue to be physically active, you know, either once you're done your rehabilitation or it can be in conjunction with that rehabilitation. So I think we kind of work, you know, side by side. Yeah, in terms of our scope, we sort of focus on that long-term engagement in physical activity.
That was a very clear explanation. Thank you for that.
Good.
I finally understand the difference.
Great.
Now, how has COVID-19 impacted the field of kinesiology and behavioral change? What observations have you made?
Yeah, you know, Eileen, I think that obviously, you know, COVID-19 has come with a lot of bad, but I think that we're also seeing a lot of good come from it too. This has had such a, you know, we were just chatting about how COVID has had such a significant impact on so many people's lives, but it's made us rethink a lot of the things that we, you know, thought of as status quo, like maybe we should change those things. So I think the focus on remote delivery has been a really great outcome of COVID, where we've had to transition and pivot really quickly to delivering care online. And we've learned a lot about, you know, providing, you know, from my perspective, you know, exercise prescriptions and, you know, physical activity opportunities, either through things like Zoom. We've transitioned now to a lot of even telephone-based physical activity counseling, which, you know, we thought for the longest time, like, oh, you know, we really need that in person. And I do think we, at certain points, you certainly need that in person. But even the research and the data is showing that, you know, how we deliver physical activity on the phone versus in person, like we're using a lot of the same techniques and styles of delivering and engaging, and we're seeing equivocal results. So, you know, I think that it shows that there are options for us. The other thing that I think has become really cool is that being a physical activity researcher, seeing how much government even has prioritized physical activity. So if you look at, you know, we're here in BC, how much, you know, Dr. Bonnie Henry and her team have emphasized the importance of getting out, like going for walks, being physically active, despite being, you know, in our greatest level of restrictions. physical activity was always prioritized, which is really great to see in the physical activity realm. But yeah, and I think maybe the last thing I'll comment on that is just COVID has really highlighted the health disparities across diverse populations. And I think it's really like lit the fire in making sure that we include diverse representation. So whether that's gender, people of color, people with disabilities, right? Like we need to have diverse representation at the table to make sure that our research and our subsequent interventions, like they are accessible, like they are tailored to meet diverse needs. So I think, you know, there have certainly been challenges with COVID, but I think there's been a lot of good because we've had to really like rethink what we thought was normal. So I think it's had us given us the opportunity to reflect and maybe make some changes.
Definitely. Now, speaking of change, from your work experience, what are some barriers to achieving behavior change? What are some ways to overcome these barriers?
Yeah, I mean, yeah, I think we've had many conversations, Eileen, about barriers, and uh, you know, like we know that there are over 200 barriers that we've recorded for people with disability participating in physical activity. Eileen, you and I have done some work along with the Arthritis Patient Advisory Board on how strength training in particular, you know, presents with numerous barriers, right? Like there's, you know, pain, like fear of doing further damage to your joints, you know, inflamed joints that make even holding a weight challenging. You know, thinking about medication side effects, you know, that makes it perhaps, you know, we've talked about how sometimes that makes it hard to focus and remember, you know, a program that, you know, we might have just gone through. So, yeah, so I think that actually one of our students, so Michael Wu, is a UBC med student that's been working so hard with us and APAB, the Arthritis Patient Advisory Board. And we're actually currently right now wrapping up a scoping review to basically like add to guidelines. So we know like frequency, intensity, time type, volume progression, like all those parameters of like the numbers of how we prescribe, right? But we really need to move beyond that and start thinking about the practical considerations for delivering these prescriptions. So how do we deal with pain? How do we deal with flares? How do we deal with that fear of doing further damage and still exercise? So yeah, so we do have, I can share some sort of take homes in terms of solutions if you'd like. Yeah, so I just maybe a few things that I think about is, you know, number one is listen to your body. With pain, it's a scary beast, right? Especially living with arthritis. So some of the recommendations that, you know, we've, you know, started to, you know, this doesn't just come from us. This is, you know, a compilation of what we've seen across the literature and guidelines, recommendations, and reviews. But if you do a workout and if you look at your pain, you know, a couple hours later and it's higher than what it was before you started your workout, that's just a good sign that, you know, maybe we need to reduce that intensity. What about thinking about like where you're experiencing that pain? DOMS, delayed onset muscle soreness, is, you know, that nasty achy feeling that you get when you've done a workout that's harder than what you're used to. That DOMS, like that pain in the muscle, like that's okay. It sucks, but you know, that's your muscle going through some physiological processes. Just, you know, with that new workout, that new stimulus. Whereas differentiating that, so that DOMS pain that's not necessarily harmful from, you know, perhaps joint pain, that might be more harmful. So coming back to that, you know, is it worse? You know, how long is that pain lasting for? So yeah, thinking about and working with your healthcare provider to get a better understanding of what's good pain and bad pain. Some other things that I would think about is planning exercise for when your medication is most effective for managing your pain. Or also considering when the side effects of your medication make it hard to exercise, right? I think, Eileen, you can probably speak best to that, you know, yourself. And I don't know if you wanted to add to that too, Eileen, of, you know, your experience in timing your exercise and when's a good time, when's a bad time, thinking about your infusion dates and things like that. Yeah, if you wanted to add anything to that, Eileen.
Yeah, well, for me, mostly I'm on a once a month biologic infusion, and usually the week before it, I go for more lower intensity, kind of give myself more wiggle room exercises because I'm just probably not going to be as active. And then after my infusion, I typically give myself a couple days of just go for some walks. Don't worry about lifting weights, that kind of thing, because
Yeah.
I know how my infusion interacts with me, and every patient is different, right? So it's really
Yeah.
listening to your body, tracking your health and learning that. And also, I find with myself too, one thing that I know that many people don't necessarily think of when it comes to exercising with arthritis, but the mental health aspect of it can be really
Mhm.
big challenge and one of the barriers for me. Do you have any tips or a behavior change, lifestyle tips for people with RA that might be struggling with their mental health that might be kind of pulling them back from exercising?
Yeah, I mean, mental health is, something that we see, not only with people with arthritis, but, across our population. It's really quite prevalent. I think, number one is thinking about how, exercise can actually help improve mental health. Of course, it's hard to come out of that cycle, right? Where, along with, mental health issues is that, it's hard to come out of that cycle of, you might feel that fatigue. You don't necessarily like feel that motivation. There's a lot going on that, um, in terms of prioritizing that exercise. But sometimes if you're able to change one thing, like I think about change one thing, do one thing for yourself, for your physical activity to hopefully start a new cycle. So I guess knowing the benefits of exercise and how that can affect things like mood and the symptoms that come along with things like anxiety and depression. But yeah, and then being kind to yourself too, right? Like I always sort of recommend, when you're thinking about your warm up, like allow that as your time to give yourself a sense of like, what am I prepared for today? And to be okay with, you might have goals. And some days, like those are the days to hit those goals. And some days are the days to taper, pull it back and say, hey, you know what? High five. I'm doing something. And I think that's the really cool thing about the new 24-hour movement guidelines is that we now know that something is better than nothing. We used to say that you had to do it in 10-minute bouts. Um, Canada and, the states and the World Health Organization have now come out and said, you know what, like doing light intensity physical activity, that counts. Like, when you're, sprinting to catch the bus because you're late, right? Like that counts. Taking the stairs instead of the elevator, that counts. So yeah, like recognizing when you're doing those little things for your health, I think is another good way to sort of boost your confidence and help you break out of that cycle into a new cycle that hopefully is leading towards that better area of health.
I think
Yeah.
that's actually a really important thing to make note of as somebody living with a disability. There's so much guilt coming around like, well, I can't work out like other
Mhm.
people. I can't do that. But knowing that everything I do actually counts and goes towards my physical activity is incredibly motivating and also helps eliminate some of that guilt that I'm not doing enough. So I think that's a really good mental
Yeah,
health tip for exercise. I think motivation is actually one of the biggest barriers for when it comes to exercise for, I think, anyone, but particularly with
yeah, of
RA, because we're dealing with a lot of symptoms already.
course. Yeah.
Now, I have another question for you before we
Okay,
end
hit me.
soon, but how can patients and healthcare providers work collaboratively to improve patient outcomes?
Ah, I'm so glad you asked that, Eileen. I think that's something that, just as a principal, we really need to emphasize like the importance of collaboration. So I sort of think it is, you take that approach of the spirit of motivational interviewing where it's a very client-centered style of conversation. And one of the tools that I think is like the easiest thing to think about is like ask open-ended questions. Like I, I was kind of joke that, I became this like nosy question asker because I grew up, my parents owned like the local general store and they had a rule like you always say hello and like, ask someone, how your day was and you chew the fat, right? Like I think chewing the fat is important. But especially if you are in, that physical activity, coaching or counseling situation, I'm thinking about questions like, what are you currently doing for physical activity? What do you hope to do? Like, what are your goals? And really importantly, like, why does that matter to you? Like, I want to tap in, Eileen, you talked about motivation. Like, what's your motivation for wanting to be physically active? Like, I know you've mentioned before, like your son Jacob is really important to you, and you want to be a really great role model. So like, let's run with that, right? I'm also thinking about like, what are the things you actually want to do for physical activity? If you tell me that you hate the treadmill, great. I'll never prescribe a treadmill for you, because the second I stop working with you, like you'll never use the treadmill, right? And what do you have available to you, right? Like that has really come like smack dab in the face for us, where, this year especially, a lot of people haven't had the access to gyms, right? So what do we have available at home? What is low cost? Like what can we do that doesn't require equipment? And then once you have this idea of like what your vision is that you really want to do and why, then you're thinking about, it's important to have that conversation of what are some of the things that could get in the way. What are the barriers, as we've mentioned? So yeah, I think it's like asking those important questions to get to know your client, and then taking all of that information to co-develop our solutions, right? So yeah, I think it's just being open to having that back and forth, and like that genuine want to know and understand someone's situation, as I think where that collaborative approach to improving patient outcomes stems from, in my opinion.
Mhm. Now, you've done a lot of collaborating with patients, which is quite
Yeah.
incredible. And that means you are definitely a great
Fun.
person to ask this last question for. And now, from your experience working with rheumatoid arthritis patients, what are some of the best exercises and exercise tips you have learned from them?
Yeah. Oh, that's a good one. Okay. Um, so why don't we start with like some exercise tips, like behavior change kind of stuff, and then we'll go into some like best exercises. Like if I could pick like your 4 best exercises. So yeah, in terms of tips and tricks for behavior change, like lifestyle tips, number one, like make a plan. If you know like what, when, where you're doing it, that helps you paint a picture and helps you to set that goal. And then, once you have that plan, monitor and see how you're doing. I know that you've used a Fitbit in the past, right? Like those technology pieces can be really helpful, but it could also be really, really simple as just like, a little pen and paper calendar, like whatever works for you. I think, obviously during COVID, this is a bit more challenging, but you can also communicate this with a buddy online, but to find someone to hold you accountable. And perhaps also, even if it's like going out for a walk, with someone, like we are social creatures, right? We need, we need human beings. So yeah, having an exercise buddy is really helpful. And you've mentioned it already, Eileen, is to not feel that guilt and to be kind to yourself, even when we set our SMART goals. Like, number one, let's start with a good goal that is achievable. But if you don't meet them, like that's okay. And I think that the again, mentioning the Canadian 24-hour movement guidelines has also helped us to feel like that's okay, because we can do those smaller bits and know that it still counts. But to also give yourself credit for doing other things like taking breaks in your sedentary time, right? I know when I get into work, I'm like, I could be here for 5 hours and never leave my chair. But I have to remind myself, okay, I need to go for a walk. Like I'll go and call family members and while I go for a walk to get that social time in, right? Making sure that you're getting enough sleep, those 7 to 9 hours, depending on who you are, and to know that those behaviors are interrelated. So, that physical activity, your sleep and your sedentary time, like they all impact each other. So yeah, and I think the other thing too is like have fun. Physical activity should be something that you look forward to in your day, and not a have to. So refocus on why it's important to you, whether that's dance parties with your kids. Like maybe you've got a love for sports, maybe you do love going to the gym, or you like connecting on like online Zumba classes. And actually, I don't know if I've mentioned this to you, but my students, one of the courses that I teach is adaptive physical activity, and my students have phenomenally put together this list of online accessible physical activity resources during COVID. Yeah, so I should send that to you. And so yeah, they've done a really nice job of putting together like synchronous classes, like online exercise videos, even things like podcasts, to help
Perfect.
people get active during COVID. So yeah, those would be my behavior change tips. In terms of exercises, I would say, like, do you want me to show you them, or
Sure.
yeah, I don't know if that's helpful. Okay, good. The room is not too messy. um, yeah, so I would say, and maybe I should have worn a different shirt for this, but
No, I love that
um,
shirt.
yeah, thanks. So your squat, right? I'd say number one, right? Because that's the stuff like, how are you getting in and out of in and out of a chair? How are you getting on and off the toilet, right? That's one.
Yeah.
Another one is the lunge. So sorry, let me see if I can put this maybe somewhere else. So your lunge there. If you've got difficulty with, if that's painful for your toes, maybe you're modifying that reverse lunge to something like a side lunge, right? Again,
Oh.
really, really interesting shirt that I've worn for this. Right. And if you want to see kind of better technique of, better video knowledge, you can always Google lots of videos out there, and you can take a look at some of the videos that my students have posted. So that's what I would do for lower body. For upper body, I love to combine, I think we've done this one together, Eileen, but taking a bicep curl and then translating that to an Arnold press. So you're kind of curling up, and then you can do double if you want, coming out, pressing upwards, back down, in towards the middle, curling back down. Just a lot of different ranges of motion that are important for things like lifting something, right? If you've got a baby, lifting a baby overhead, picking up your groceries, and then some kind of pull. So if you've got access to like a TheraBand, or if you have gym equipment, right? Something where you can pull in towards, in towards the ribs, thinking about squeezing those shoulders, those shoulder blades down and back. Just nice for postural health, but you have to open a door towards you, right? Lots of those things are important for that pull motion. So yeah, that's my really rudimentary and very poor videoing skills of some what I would say are probably like my top 4 exercise movements that I would include. If you had to bare bones it, do those.
Yeah. You start small and build from there. They all
Mhm.
matter. And yes,
Mhm.
living with RA and doing those exercises, those have been very beneficial for me.
Yeah, and that's a great piece of advice that you've mentioned there too, Eileen. And I've learned a lot from working with you and other patients with arthritis. Just that importance of trial by fire, because like you said, start low and go slow, so you can kind of see where you're at, how it feels, how that affects your joints, how that affects your pain. But ultimately, everyone's going to be so different, and even within the individual, it's going to vary from day to day, right? So yeah, like be open to experimenting, but take it slow, that so that you can kind of see, you run sort of your own experiment of, what does this do for me? Does that work? Great, we can keep going with that. That didn't work. Okay, let's try something different.
And what's a great way for patients to know if it didn't work for them?
Yeah, I would say, if you it comes back to that pain issue. If you are seeing that pain is increased, like you're worse off than when you started, a couple hours after your exercise, then maybe you want to reconsider. And also thinking about your fatigue, right? So if you really sort of overdid it and you notice that you're kind of down for the count for the next couple of days, maybe that's another sign that we need to reduce either your volume, or how much or how long you're doing something for, or the intensity, so how hard you're working.
All right. Well, I want to say thank you so much for being here today and showing us those exercises and talking to us today about this. Every time I speak to you, I always learn something new.
Oh,
Thank you
good.
for all you
Likewise,
do.
Eileen.